There are several myths surrounding breastfeeding, and in this video, we will be debunking such myths and stating the fact about breastfeeding. Number one myth is that breast size affects milk production, or that you shouldn't breastfeed if you have small breasts, or that if you have small breasts, you will not have enough milk supply to feed your baby. Well, the fact is that breast size does not correlate with milk production. It is the milk producing tissue that determines milk supply. Women with small breasts can produce just as much milk as those with large breasts. Myth number 2. Babies should breastfeed on a strict schedule, or that you need to nurse every 2 hours around the clock to make sure your baby gets enough milk. But the fact is, breastfeeding works best when it's responsive and based on baby's cues. Feeding on demand helps establish a good milk supply and ensures the baby gets enough nutrients. Scheduled feedings can hinder milk production and lead to breastfeeding difficulties. Myth number 3. Mothers must eat only bland foods while breastfeeding, or that mothers should avoid certain foods while breastfeeding. The fact is, most breastfeeding mothers can eat a varied diet without any issues for their baby. By the time the foods you eat have been digested and used to make breast milk, the potentially upsetting elements have been broken down and should not affect your baby at all. You should only avoid foods where the baby shows signs of sensitivity. Myth number 4. Formula is as good as breast milk. Inasmuch as formula is a good alternative to breast milk, the fact is breast milk provides unique antibodies and nutrients tailored to the baby's needs, which formula may not replicate fully. Myth number 5. Breastfeeding ruins your breast, or that your breast will sag forever after breastfeeding. Now, the fact is, pregnancy and age are the most significant factors in changes to breast appearance. Breastfeeding doesn't inherently cause sagging. Sagging is a natural part of aging and hormonal changes. Myth number 6. You can't breastfeed if you have inverted or flat nipples. Well, the fact is, most women with inverted or flat nipples can breastfeed successfully with proper latch techniques. Using a breast pump or nipple shield can also help. Myth number 7. You can't breastfeed if you are sick. Well, the fact is, in most cases, breastfeeding can continue even if the mother is sick. Breast milk provides antibodies that help protect the baby from illness. Myth number 8. You should toughen your nipples before breastfeeding. The fact, however, is nipple toughening is not necessary. Proper latching and positioning along with lanolin or nipple cream, if needed, can help prevent soreness. Myth number 9. You should stop breastfeeding when your baby gets teeth. Fact is, babies can breastfeed with teeth. Proper latch and positioning are key. If the baby bites, gently remove them from the breast and discourage the behavior. Myth number 10. Breastfeeding in public is inappropriate, or that you shouldn't breastfeed in public. The fact, however, is breastfeeding in public is legally and socially acceptable in many places. It is a natural and normal way to feed a baby. Mothers have the right to breastfeed wherever they feel comfortable, and many countries have laws protecting this right. Myth number 11. You can't get pregnant while breastfeeding, or that breastfeeding is a reliable form of birth control. Sorry to burst your bubble. The fact is, while breastfeeding delay ovulation, it is not a reliable form of contraception. Myth number 12. Breastfeeding mothers should drink lots of milk to produce more milk. The fact is, while staying hydrated is important for breastfeeding, drinking excessive amount of milk will not necessarily increase your milk production. A balanced diet and adequate fluid intake are sufficient. I'll see you on the next one.